Hello everyone, welcome back. In this video I will be discussing about the first rib. So this is the first rib. As we can see, this is atypical rib, one of the atypical rib. Why it is atypical? Because it is having some special features which are different from the typical ribs. So this is the strongest, broadest, flattest and stoutest rib of all. Then it is having two ends. This is the posterior end, this is the anterior end. Anterior end is broad and this is articulating with the sternum with the help of costal cartilage. So here there is an attachment of first costal cartilage which is articulating this rib with the sternum and forms chondrosternal joint. Then this is the posterior end. This posterior end is having a facet. This rounded structure is known as head of the first rib, and this facet articulates with costal facet of the first thoracic vertebrae. Then just lateral to the head we have the neck. So this constricted portion, this is the neck of the first rib. This neck is directed upwards and laterally. So this is the direction of the neck. Then lateral to the neck we have this tubercle. This tubercle is also bearing a facet. As we can see here, this facet is articulating with the transverse process of the first thoracic vertebrae. Then we have this angle of the rib. Then this is the shaft of the first rib. This shaft of the first rib possesses the inner border and this is the outer border. The outer border is convex and the inner border is concave. This inner border possesses this tubercle known as scalene tubercle. Just anterior to the scalene tubercle there is a groove. Here we can see this is the groove. This groove is for the lodgement of subclavian vein, and behind this tubercle again we have a groove. This groove is for subclavian artery. Then we have two surfaces in this rib. This is the superior surface which is roughened and this is the inferior surface which is smooth. Then the attachments of this rib can be understood with the help of the diagram. So first we discuss the diagram. Now here we can see this is the neck of the first rib. Now the relations which are important on the anterior surface of the neck of the first rib, these are from medial to lateral side. The first structure is the sympathetic chain. Then we have posterior intercostal vein, first posterior intercostal vein. Then we have lateral to it, this is the superior intercostal artery. And then the lateralmost structure is the first thoracic spinal nerve. So this is the ventral ramus of the first thoracic spinal nerve. This is merging with the C8 spinal nerve and forms the lower trunk of the brachial plexus. So here we can see the passage of lower trunk of the brachial plexus on the superior aspect of the shaft of the first rib. Then on the scalene tubercle we have the attachment of scalenus anterior muscle, and posterior to it we have the origin of scalenus medius muscle. Then on the outer border which is roughened, here we have the attachment of first digitation of the serratus anterior muscle, and this is the superior surface of the anterior end. Here we have the attachment of subclavius muscle, and posterior to it we have the attachment of costoclavicular ligament. So these are the attachment on the superior aspect of this bone. Then this is the inferior surface of this first rib. Close to the outer border we have the attachment of external intercostal muscle, and medial to it we have the attachment of internal intercostal muscle. You should remember that internal intercostalis intimi is absent in this bone. Also we don't have the costal groove over here. So these things you should know about this. Then we come to the side determination of the first rib. For determination of the side we have to keep this bone in the table, or we can put this bone on the flat surface like this. Just that we are putting this bone in our body. So this is the anterior end, it is placed anteriorly, and this is the posterior end, it is placed posteriorly. And if this is the superior surface which is roughened, this is placed on the upper aspect, and the smooth surface is placed on the surface of the table or a flat surface. Then if both the ends, that is anterior and the posterior end, they are touching the flat surface simultaneously, this bone is belonging to that side. Suppose I have put this bone on the left side, then the both ends are touching this flat surface or table simultaneously, so this bone is belonging to the left side. Similarly, this is the bone of the right side. So I have put this bone like this. This is the anterior end, this is the posterior end. Both ends are touching the flat surface simultaneously. So this has been put on the right side, so this is the bone of right side. If I change the position like this, here we can see this posterior end is not touching the surface, so this is the wrong sided bone. So if I put this bone on the right side, then both the ends of this bone, they are touching on the flat surface. So in this way we can easily identify the side of the bone. To keep this bone in the anatomical position, we have to first hold it like this, anterior end on the anterior aspect, posterior end posteriorly, and this posterior end is slightly above than the anterior end. It is not placed horizontally, it is slightly above the anterior end. This posterior end is above the anterior end. So this is the anatomical position of the first rib. You should remember that posterior end is above the anterior end. So this is all about the first rib. I hope you understand well. Thanks for watching.